We are going to start with the Omicron outbreak in South Korea that only appears to be getting worse, and experts say, hopefully anyway, that it's quickly approaching its peak. Daily infections have been in the six-figure range now for weeks, and the country is set to pass the 8 million mark in total infections any day now.
For more on the situation and where South Korea goes from here, we turn to our Han Seong-woo, who joins us live in the studio. Good morning, Seong-woo.
Good morning. Happy to be here.
Thank you for joining us. But we hear that COVID-19 tally for today is going to go up dramatically. Tell us more on that.
The 400,000 range, actually, and that's right. I mean, this isn't even the final tally even. We'll be seeing a record high of possibly close to 500,000 once the official numbers come out in an hour or so. Through 9 p.m. Tuesday, Korea time, health authorities logged 441,423 new cases nationwide, up more than 116,000 compared to the same time on Monday, and already over 50,000 more than the previous all-time daily high of some 383,000 recorded over the weekend. The new infections up until 9 were almost evenly split between the capital region and outside, with Seoul and its neighboring Gyeonggi-do province each reporting well over 90,000 cases. Included in the preliminary tally are not only positive PCR tests, but also positive results from professionally conducted rapid antigen tests, which authorities believe is one of the reasons behind the sharp hike, along with the nation's gradual easing of prevention measures and the rapid spread of the so-called stealth Omicron. Health authorities had earlier predicted the Omicron surge would hit its peak sometime between today and the 22nd of March, reaching a daily average of as high as 372,000, before beginning to decline starting next Wednesday. The number of severely ill patients undergoing intensive care reached an all-time high of 1,196 on Tuesday, and that figure is projected to shoot up to around 2,000 by the end of this month or early April. And reports say the government is preparing updates to its social distancing scheme in the coming days.
Yeah,
is that correct, Mark?
Yeah, you're going to tell us more about that. But it really seems right now that the numbers are that high that it's like everyone that we know in our social and family circles has contracted the virus or has it right now. But yeah, tell us more about these updates to the social distancing.
Right, so it's likely officials will be announcing the changes on Friday, a couple of days before the current social distancing scheme, which limits private gatherings to 6 people max and restaurant business hours to 11 p.m., expires this coming Sunday. The country is considering several options for its next scheme to come into effect next Monday, including maintaining the current guidelines, further relaxing them to allow gatherings of 8 max and food establishments to operate until midnight, or even completely lifting the rules altogether. Before authorities make a final decision, though, they'll be holding in-depth discussions with stakeholders, including related ministries, local governments, and of course, medical personnel and business owners who will likely clash on how to move forward.
But I think South Korea is gradually moving back toward normality, right?
That's true. Gradually moving towards normality. That is the perfect expression. It seems that at this point, with over 1.61 million people undergoing at-home treatment, the government has acknowledged there's only so much hospitalizations and antivirus curbs can achieve. Health authorities have even hinted that the risks posed on the generally healthy population may have to be reevaluated.
Around 2,500 to as many as 5,000 people a year die from the seasonal flu. Pneumonia, meanwhile, claims tens of thousands of lives, so there's a need to analyze and evaluate COVID-19's death toll from a comparative standpoint with other diseases.
One example being the government's decision to exclude those with underlying conditions in their 50s from the so-called concentrated bracket starting Wednesday, that's today, to focus more on those over 60 and those with weak immunity.
Right. As always, Seong-woo, thank you so much for your report. We'll talk to you again tomorrow.
A pleasure.